Yaya Konarata Goa, Watkonuradu Zuwego Jodaron Yujats. Welcome along to the COVID-19 Task Force Daily Update. On the program today, Lloyd, Phillips, and Lisa Westaway will be here, but we're going to start off speaking to a gentleman who hasn't been on for a little while, and we welcome back Grand Chief Joseph Tokwiro Norton. Tokwiro, how are you? I see you have the playoff beard going. Okay, earlier today, the Mohawk Council of Kahnawake issued a press release basically talking or reminding the community and others that the COVID-19 task force is not a political body. Why was that put out?
Is what the warrior knew, and scholar is one of two done any only so that Garide quite never but Joe with the then as what our Garide. Yeah, Joe, it's I guess it's during these types of situations that we always will encounter people who feel that they're not getting proper services or not getting the proper answers. So they tend to go after those that stand in front of the camera, you know, every day, twice a day, and whatever on the radio, and they'll ask for them. They'll want to speak to them directly. So sort of like, you're the boss, you should know everything, and therefore you should be able to answer questions that we have for you. And quite often there's a mixture of in these questions of you know, maybe direct specifics about what their concerns are with the COVID, and they didn't understand something. They want to get their memories refreshed and so on and so forth. But then it gets into the political also. They start asking political questions of the task force members. In particular, they'll see Lloyd, you know, and they'll want to know exactly what you know. There's a political kind of spin to their questions, and in reality, that should be directed towards the council, the chiefs. If it's a political matter, then talk to the chiefs. Ask us what our view is, what our opinions are. And if we can help you, then we will. But generally, we shouldn't be burdening the task force with those kinds of questions. They have enough to do. They have enough on their hands. They have enough calls coming in continuously. So we should be able to, you know, focus on what you feel is the problem that you're having or the misunderstanding you're having. Don't turn it into a political issue, because there's no need to do that, okay? It's hard enough the way things are at this point in time. And personally, I feel the same thing that a lot of the people do, in terms of being isolated, not being able to go as I please and do the things that I did before, sit in a restaurant, you know, at a fine restaurant and all that kind of stuff. Well, it's too bad at this point in time, but that's the way it is. And it's all for the sake of the health and safety of our people, especially the little ones, you know. I always keep repeating that. My grandchildren stand on the road over here. They're jumping around and screaming and yelling. Baba, Baba, how are you?
And you do some jumping back, so.
Oh yeah. I'm in the house, jumping up and down, and so that's the kind of message I want to get out there, and I want people to acknowledge that. It's a reminder too of the situation that we're in. You know, it's not easy. None of us have ever encountered this, I would assume, unless you're from a foreign country somewhere where maybe something happened there during your lifetime. But here, you know, it's not something that we're aware of. I just remember my parents telling me, like in 1918, 1919. They had the Spanish flu here, and many people died. As they died, they were buried in their yards and all over the place. No time for funerals, no time for anything like that. Fortunately, we're not in that circumstances. Fortunately, things have changed since 1918, 1919. We're now into a modern era. But again, people are still scrambling, world leaders and specialists and scientists and doctors to try and find a cure, or at least to try and stabilize the COVID-19. So we all have our fingers crossed, but they're telling us what to do, and we're coming out of this in good shape so far, and I hope we stay that way.
Yeah, I think we're all in that same boat. I know, Tokwiro, we spoke before we started, and we have a lot of elders who get to watch the program and just get the updates on the task force. You thought it might be a nice idea to say a few words to them specifically as we all go through this together. So go ahead.
What they yonder, Kishniana, then go to the Yonsas. The Nizani, so Geniji, Genua is a wonder. Ne qua. Gear and Raksat Kaha, Afghanistan, and Jogade Kiroris. So what did they? There's what? There's a one they go. There's what they go. Ziniji, Junzon, my don't know yet. Don't yet the end of the Gina hold the well, I'm a loss for words right now, but it was simply like my parents and even my grandparents telling us, always be careful, take care of yourselves, do the right thing, do the right things. And in this situation, I guess we have to look towards them too, also for guidance and support in the best way possible. So I'll finish off with that in terms of being able to take care of them, while they can take care of us too, even at this stage in their lives, no matter how old they are.
Grand Chief Joseph Tokwiro Norton, Nyauko.
Yo.
All right, so now we have a couple of speakers who you're very familiar with. Of course, we'll start off with our Commissioner of Public Safety, Lloyd Phillips.
Thank you, Joe. Well, certainly, no, I just want to touch on a few words that Tokwiro mentioned. He made reference to, this is the first time that, in recent memory, if not ever in recent history, that the world is dealing with such a pandemic, and the world leaders and community leaders are trying to find their best way through this. And believe me, in my role as the Public Safety Commissioner, I never envisioned myself to be in a position where I'm helping guide the community through this very tough time. And believe me, myself and obviously the whole task force, we don't take decisions very lightly, and it bears heavy on our minds, when we have to make some of these tough decisions that we know are directly impacting people's lives. So it's good to hear that the support is there from many different places, but certainly nobody envisioned us being in this position even just a few months ago. With that said, we did have a task force meeting today. Full task force was here. Some great discussion. Again, focusing on the the economics of our community. As we know, we said many times, we're working towards finalizing a plan for the economic revitalization of Kahnawake, and we'll touch on that a bit more. But that's certainly a very lively discussion, a very meaningful discussion, and even a heart-filled discussion, because we're always trying to balance off, okay, what's the health and safety of the community and versus the economic impact that people are currently impacted, and how do we find a balance there? And unfortunately, sometimes there is no exact balance, and so we have to make some very tough decisions and moving forward. Because as we look towards finalizing that plan, again, some more tough decisions will have to be made over the short term. Because what we're looking at doing as a task force right now, on the task force, there's a tremendous amount of responsibility that rests with us in terms of the health and safety of our community. A lot of responsibility that we currently hold that needs to be transferred. And in this case, that responsibility that we hold regarding businesses. There is going to be that need in the very near future to start that transfer of that responsibility from the task force back to the business people where it belongs, and have them take responsibility for the health and safety of their employees, their employers, their clients, to ensure that they have the tools available to make the proper decisions, but have that responsibility lie with them, and allow that transfer to take place, as well as even moving forward with the business plan and how things that will evolve, the responsibility of the community. There's many directives in place right now in terms of, again, the responsibility is with the task force, but how do we transfer that responsibility back to the individuals, back to the families, and back where it belongs? So again, there's that process that needs to take place, and that's what we're planning for, to do that in a very structured manner. Because it'd be very difficult for us to be talking about only businesses, and only reopening businesses without talking about how does that impact the average community member who's not involved in business. So again, another set of balancing that has to take place, because you can't have this one sector of the community saying, okay, you're going to start taking more responsibility, you're going to start to open up, and not look at the other side of the people who are not within the business realm. So again, more balancing, and we take that very seriously on moving forward. And then look at the impacts. Once we start moving on that path, what are the impacts on the community as a whole? Health and safety being number one, of course. But how does it impact on community members and the way they feel, on the psychosocial impacts on the community? How does it impact the organizations? So there's a lot of ripple effects. Again, looking at the best way forward. And I'm glad to say, that plan is coming together, and we're definitely on track. There's many moving parts. But really, what it really comes down to is looking at the best way to have that support mechanism in place for the businesses. There's a couple of major pieces to it. One, obviously, is the business itself that has some responsibilities. There's the existing Kahnawake economic relief measures. There's also the occupational health and safety and the surveillance mechanisms to ensure that various measures are in place. There's the need to have the health experts involved and give us information, and as well as a role for Debaduni Zakta to support businesses. Those are the broad topics, but Lisa will be up here in just a minute, and she'll go into more detail on what we're discussing in terms of building this plan and moving it forward. So with that, I'll see you again soon. So I'll leave the floor to Lisa to give more information and to follow up with some of the latest developments within the health sector.
Thank you. So just to talk a little bit more about the model that Lloyd was discussing. So when we talk about balance, the idea is to have a gradual reopening of business while maintaining the health of the community. So this is not easy, but we've tried to put a model in place through the task force that will allow us to continuously monitor and do those balances and checks. So we're going to present to you the model. The that we adopted today. So I first want to remind you about our guiding principles. We've spoken about them before, but I'm going to review them because they're important. They're what we base all of our decisions on, especially with respect to this next phase moving forward. So the first aspect is to protect the most vulnerable population. That's always been the basis of our decisions. We've spoken about, and I refer you back to the presentation that Dr. Gauthier and I did on Sunday. We talked about the elements of success, the criteria that needs to be in place in order for this to work, and identification of new cases, testing, self-isolation, contact tracing, all of that are elements that are especially important, and therefore they're in our guiding principles. In order to move forward, we have to have that in place. Health and safety measures, so infection prevention control, modifying our physical space and environment, social distancing, having policies in place that allow people to stay home when they're sick. All of these elements are especially important in our new normal, so businesses will have to take these into consideration as they move forward. We talked about a phased approach. It's not just an opening all at once. We talked about flexibility. So what we put in place on Monday may change the week after. As we're seeing in Montreal, there are changes, and we expect more changes in Montreal, and we can talk a bit about that later. We want to minimize risk from external sources. So what does that mean? We want to minimize the risk from cross-border travel. We want to minimize the risk from non-locals. It doesn't mean that we will not allow these things to happen, but it means that we have to be aware of them and we have to be able to mitigate them. Community mobilization, it's at the bottom of the list, but it's the absolute most important of the model. And we spoke about it a little bit this morning on K103. It's the idea that each and every person will be responsible for themselves as we move forward within this new model. So implementing measures for you and your families will make an absolute difference in what happens as we move forward. So as we start to slowly reopen, and we still have not established a date, but as we start to do that, we're increasing the risk to our vulnerable population. So the model we're putting in place is to try to minimize the risk, but the risk will still be there. And how we react as individuals will make a difference on the collective. And we, as a task force, will no longer be able to monitor every single thing that's happening in each of your homes, in each of your families, in each of your day-to-day lives. You're all going to have a responsibility. So as we talk about business reopening, we talk about businesses having excess responsibility or new responsibilities for their new normal, but it means that community has new responsibilities as well. And it's not going to be easy, and that's why yesterday I think I said reopening is going to be harder than the closure, because we are going to be ready to fly. We're going to be ready to try new things. We're going to be ready to get out there, and yet we still have to hold back. So we'll look at the business section. So the model, just to show the model first as a whole, instead of just the business section. Oh, he can't hear me, eh? Okay. Okay. Just to show you in general, we kind of made it a circle because the task force really wants to offer, as much as we say everybody has their own responsibility, the task force is taking a huge support role during the reopening phase. So this whole model kind of shows all the people, groups participating in the different aspects of the model in order to create that balance that I was talking about between health and between economic revitalization. So, okay, we can go back to business then, sorry. So for the business side, each business is going to be asked to prepare plans for their reopening, and it will be based on health and safety and based on the guiding principles that we talked about. So we're going to present, we will be presenting packages that will facilitate this process for all of business owners. And in fact, as we've spoken about, the team, the business team that are working really hard on establishing all of the elements required for reopening. They're working with us with them, so that we can have all of these things in place for Monday. But should you want to just start looking at it, then I suggest that you look around you. Look at businesses that are already open. Look at pharmacies. Look at grocery stores. Look at changes that have taken place in those institutions, because those places have already implemented the modifications that will be asked of you. Another thing that you can do in order to start preparing is to look at the CNESST website. We'll put the website online afterwards. So we're well aware that the CNESST does not have any jurisdiction here in Kahnawake. However, they do have many English tools available on their website that can facilitate your preparation while you're awaiting the packages from us. There is also the INSPQ website, which is the research arm of public health, and again, we'll give you access to those email addresses at the end of this, of the Facebook Live. And on there, you'll find different elements as well, specifically by industry. So there's a lot of information out there. We would urge you to start looking at it, but again, taking into consideration that we will be providing you with packages that will facilitate your preparation process. But we've had a lot of email requests about getting ready in advance, so these are areas that you can look at. So part of the support that we want to offer to businesses is with respect to occupational health and safety and surveillance. So we can go to the next box on the right. So part of implementation is having support and consultations that could provide guidance to businesses. So we know that Dewa Danizakta is there to provide reassurance, support, assistance in developing work plans, in assessing needs of businesses, but we have an occupational health team that will be also there to provide support and to provide verification regarding conformity. We are expecting that conformity is in place before we can open new business. And so again, we'll be giving you details about that on Monday. So the aspect about health, public health and safety is the next box that we're going to look at. So that's the box on the left. And so this is something different that we are doing within our model at the task force. And it's really because of the fact that we are using, that our guiding principle is for testing, identification of new cases, contact tracing. So if we take the experience that the task force had and our public organizations have had when we closed, we know that there were multiple questions. What do we do when someone's sick? How do we figure out who they were in contact with? How do we manage all of this? How do we know what to do? And how do we ensure that these people get tested, that we have quick results? So we're putting together, it'll be part of our KMHC staff, and we're going to liberate a few nurses who will make up this team for a short period of time, 3 to 6 months, so it will depend on what the needs are. And we'll be able to provide support to businesses regarding all of these aspects. So that essentially makes up the community support model. It doesn't give you a lot of detail about the actual business reopening, but we thought we wanted to share at least the model that we're going to be implementing, so that you see that there is a balance between support, reopening of business, and public safety. So we're again, of course, going to be monitoring as we move forward all of the elements involved in COVID-19. So how our numbers increase, mostly with respect to positive cases, which we want to test consistently. So all of this we'll be presenting to you next week. So I hope that that is helpful. We want to reassure, we want business and community to take responsibility for themselves, but in this transition phase, we will be providing a lot of support. So we hope that this demonstrates it. So I'm going to move on to the testing site. So we have a bit of data that's come out from the testing site up to yesterday at the end of the day. So what we know is that we have contacted over 50% of the Kahnawake directory. And we know that we have had over 400 participants This is incredible. So I'm told this is higher than Angus Reid, but I don't know all the details about that. But what it means, what I can say is that the results that we're going to get from this health check are valid and reliable. So that's very positive. As of yesterday, 7 to 8% of participants had at least one symptom. And in fact, we are at now 92% of people who were surveyed or who were telephoned who don't have any symptoms. So that's higher than what we were at in mid-April when we did the survey, when we did the online survey. I think at that point we were at about 78% with no symptoms, and now we're at 92%. So that's great, that's an increase. So what we do see, though, is that the average age of those presenting at least one symptom and an average of 2.5 symptoms is the average age is just over 60 years old. So we want to just make a little shout out because we know that the literature is demonstrating that people 60 and over are more at risk for complications. So we want to make a little shout out for those who are over 60 that if you haven't been called yet, you will be, but we're urging you to contact us if you have symptoms so that we can organize your testing. Besides that, we do not have all of our results yet from the increased testing that we've done, but we have increased our testing significantly as a result of the calls. So I just want to congratulate everybody for being involved in this and allowing us to make this successful, because it's really going to help us moving forward. The data will help us analyze what's happening when we reopen business. So this data is extremely important to us as we move forward. I want to talk a little bit about elements that Legault has been mentioning in his daily updates. So we are very well aware that Legault is starting to loosen up some of the measures and directives that have been implemented regarding quarantining of residents in long-term care facilities, in private residents, in intermediate resources, and in family-like resources. And some of those loosening up, some of those measures that are being loosened up are with respect to removing loved ones from the facility, or there's some loosening up on certain limited visitation rights. So we have not spoken to you about that yet because we are just in the process of analyzing all of those documents. What is clear from the documents is that there will be no change to the measures until May 11th at least. And so this is just a preliminary communication of the measures that may be to come. And as of May 11th, these loosening up of the measures will happen only in phases and by region. So there's still a lot of analysis that has to be done, even on the part of the ministry, and unfortunately that wasn't all communicated in the media over the last 2 days. But it's important that we let you know about this. In Kahnawake and the task force, KMHC, Elders Lodge, KSCS, we still have not made any formal decisions about what these measures mean for us. And we would like to just communicate to you the importance of these decisions, especially in light of the openings that are upcoming, the opening of business. We want to be careful not to just open up everything all at once without having control of the consequences. And we know that by opening business, we increase risk. By opening visitation, we increase risk. So we talk about balance all the time. So the idea of balance between life and death, between mental well-being and decompensation, between economic vitality and losing one's business. These are all decisions that we have to grapple with on a day-to-day basis as a result of what we're living. So we just ask you for a bit of patience while we analyze these documents from the government, and while we make some decisions and consultations about how we should move forward. So a bit of good news, though, is Mother's Day is coming. So we've tried to put together something that will give you a little bit of relief and happiness. So at KMHC, although we've been very strict about not allowing any deliveries to your loved ones, we want to open that up a little bit for Mother's Day. So there will be a public service announcement that will be put on our website after probably by the end of the day or tomorrow morning, but I'll give you the information. So on Sunday, May 10th, between 10 and 1 o'clock, the testing site location, there will be no testing and the site is clean, but the location will be available for you to drop off from your car items for your loved ones. So we know that often family members will bring soap for their family members, shampoo, souvenir items. So we'll be open from 10 to 1. We're going to have a group of staff members who are going to be well trained to just take the item from you, wash it down, and bring it to your loved ones. So it will all be safe. If you give cards, that's okay, but please do not seal the envelopes because we have to remove them from the envelopes to give them to your loved ones. We ask that there still be no food. Nothing, no food, no food items, store-bought, homemade, restaurant, no food items whatsoever. You could deliver flowers as well, and we'll wash off all of the flower pots, but it has to be from a local vendor. So you cannot order flowers and have them delivered from outside of Kahnawake. Please label the items very clearly so we make sure that we give the item to the right person, and please do not wrap any gifts. So we'll be putting all of that information on the website, but we just wanted to let you know that we think that this will make your loved ones very happy, and I hope for you as well, because we do get a lot of calls asking if you could bring things in. So for the Elders Lodge, I believe that they are also planning something special for Mother's Day, so I don't have all the details with me right now, but you will get those details tomorrow. I think that's it for my updates, so I want to just thank you, and I'll see you tomorrow.
All right, Nyauko, Lisa, and it really is good to end with a little bit of good news because I know lots of people were talking about Mother's Day coming up, and Mother's Day is probably one of the most special days of the year. I mean, Father's Day is nice, but Mother's Day has that little more sense of importance. So I'm glad that this is going on. I'm sure that everybody out there is glad as well. So I'll look for the details tomorrow. It'll be in the media as well. And in the meantime, we'd like to thank Lloyd and Lisa for their presentations today, and Tokwiro, Joe Norton, also joining us on the program, and you as well. So thank you. We'll see you tomorrow. Nyauko Dano, Onagiwahi.